Shoulder impingement. It's a very common problem that we see in physical therapy quite a number of times with regards to shoulders, and it really comes on for a number of different reasons, but some common reasons why you will experience shoulder impingement is that there's a lot of tightness in and around your shoulder, whether it be in the muscles in the front or the muscles in the back. Those same muscles sometimes can be very weak. Most commonly, that tightness and that weakness closes the space between the ball, the top of the head of the humerus, and the collarbone, and it closes that space. And what happens is any one of three structures get pinched on, whether it be the bursa, your rotator cuff tendon, or the cartilage will get pinched on, and that's what causes pain. And that pain will present itself as an ache in either your shoulder or your upper arm down into your elbow. It'll also turn into a sharper pain when you reach for something. How does it affect you? Well, it affects you in the sense that you're having a hard time reaching across your body or reaching back behind. One of those structures is being pinched on. What can really be done to help that is you've got to open that joint space up. You've got to get the pressure off of that tendon, off of that bursa, off of the cartilage, whatever it is. That's where some specific exercises come into play to stretch things, to strengthen things. One of the greatest things about physical therapy is that we can put our hands on a patient and do a number of things with that. One, figure out, is that space in the joint as much as it needs to be? And if not, what needs to be done to get it to be as open as it should be so that we can get the pressure off of the rotator cuff? Number two, we can evaluate how strong and how stretched out something is, how loose something is, get that space back to being open. But the greatest thing about physical therapy and the expert physical therapists that we have here at Loudon Sports Therapy Center is that we put our hands on the patient, we devise a treatment plan specifically to the shoulder problems that you're having, because even though every shoulder problem has a rotator cuff involvement, every shoulder problem is different. We figure out exactly what your rotator cuff is or isn't doing properly and address those symptoms. So if you're having any problems in your shoulder, stiffness, aches, sore, pinch, cracking, popping, you name it, get yourself in here, get yourself scheduled for an evaluation. Let's get our hands on you. Let's figure out what's causing your problem and get it taken care of before it turns into a much bigger problem.